Okay, good afternoon everyone, and thanks for joining us for the Positive Choices webinar series. And in today's webinar, we're going to be providing some information about personality targeted interventions for the prevention of substance use and mental ill health. So in just a moment, we'll be starting that webinar. But beforehand, my name's Lexine Stepinski. I'll be chairing the session today. And what I'd like to encourage you to do is if you do have any questions at any time during the webinar, to please shoot them through to us when you think of them on your panel. So there's a questions panel on your control box. So just send them through, and then we will have a Q&A at the end with our speakers answering those questions. And so the aim of Positive Choices, as many of you probably know, is to assist teachers, parents and students across Australia to access up-to-date and accurate information about alcohol and other drugs, and also prevention programs that can be implemented in schools and that are, have proven to improve student wellbeing. And so as part of this initiative, we provide this webinar series for teachers, parents, school leaders and anyone working with young people. And so over the year over last year, we've covered a number of different topics. And in case you missed any of our webinars from 2016, you can actually watch them on demand. So we have a webinar about how to respond to the challenge of so-called legal highs. We also have a webinar about helping your students to engage with evidence-based drug education, and also a webinar looking at drug and alcohol and the effects on the adolescent brain. So I'd encourage you, if you're interested, to visit our website to view any of those previous webinars. And we also have coming up in May, so the 25th of May, we have another webinar focusing on what parents can do to prevent teenage substance use. So you can also register for that webinar as well. And if you haven't already visited Positive Choices, I would encourage you to do so and have a look at the range of resources that we have available there. And if you would like to provide suggestions for what you'd like to see on Positive Choices, or perhaps suggest a topic for one of our future webinars, please email us through. We'd love to hear from you at info@positivechoices.org.au. But so now what I'd like to do is introduce our two speakers for today. So we're very lucky to have two speakers with us and two fabulous speakers. So first of all, Nicola Newton is Associate Professor at the National Drug and Alcohol Research Centre, and she's also Director of Prevention within the NHMRC Centre of Research Excellence in Mental Health and Substance Use, or CREMS, if you don't want the full mouthful. And she spent 2 years working at the King's College London, where she worked closely with Professor Patricia Conrad, who is the developer of the Preventure program that you're going to hear all about today. And Nikki led the adaptation and the first ever trial of Preventure in Australia. So we're very lucky to have her here to talk to us about this really important work. And our second speaker joining us today is Erin Kelly. So she's a clinical psychologist and a PhD candidate at the National Drug and Alcohol Research Centre, and she was lead facilitator of the Preventure sessions in the first ever trial of Preventure in Australian schools. So she'll have lots of clinical on-the-ground experience that she can talk to us about today. So before any more introductions, I'll pass over to Nikki first of all, who's going to talk to us about personality targeted interventions to prevent substance use and mental ill health, the Preventure program. So over to you, Nikki.
Okay, thanks for that, Lexine, and thanks everyone for attending today. So today I'm going to start by giving you a background into why it's so important to prevent, as well as a background into Preventure and these personality targeted interventions. I'm then going to hand to Erin Kelly, who's going to talk about the adaptation of this program for Australian students and give us some clinical examples. And finally, I'll then talk to you about the results from the Australian trial of Preventure. So why is it so important that we prevent? Well, we know that 240 million adults suffer from an alcohol use disorder worldwide, and we know that the burden of disease and costs associated with this use is substantial. Amongst our young Australians, those aged 12 to 17 years, 3/4 have tried alcohol, over 6% binge drink at least weekly, and that is have more than 4 standard drinks on one occasion. and 62% have said they've experienced at least one negative harm as a result of their alcohol use in the past year. We also know that the earlier someone starts to use substances, the greater chance they have of developing substance use disorders, as well as comorbid mental health problems, dropping out of school early and having poor academic performance, and as well as developing a range of neuropsychological deficits, such as in memory and attention. But the good news is that for each year we delay the onset of drinking, we are able to reduce the odds of developing an alcohol use disorder by almost 10%. And this is why effective prevention is so critical. So some of you may know, but there's generally considered to be 3 types of prevention. The first is universal, and these are programs that are delivered to an entire population, such as a whole school year group, regardless of their level of risk for developing a problem in the future. They have a lot of advantages. They're very easy to implement in the school environment. They're often cost effective, but we know they only yield modest effect sizes. That's because they're trying to have that change on the bigger population level. The second type are selective programs, and these are targeted to groups at greatest risk of developing problems, such as those with underlying vulnerability to substance use. These programs tend to yield larger effect sizes, but they're often associated with stigma because we have to screen those individuals out before they can participate in such program. And the final type are indicated programs, and these are also referred to as early intervention. They're delivered to those already experiencing symptoms of a disorder, and they're often the most costly to deliver. But today we're going to be focusing on one selective program called Preventure. And Preventure is a program that overcomes those obstacles we often see with selective prevention. That is, it overcomes that stigma so often associated with them. So what is Preventure? Well, Preventure are a range of personality-targeted prevention programs for 13 to 14-year-olds. They aim to increase coping skills amongst adolescents to then prevent alcohol use and associated harms in high-risk adolescents. And they do this by targeting 4 personality profiles that have been linked to adolescent substance use and psychopathology. And these 4 are negative thinking, and these are individuals who tend to experience low mood and have negative beliefs about themselves, others, and the future. Our second type are anxiety-sensitive individuals, and these kids or people have a fear of anxiety-related physical sensations. Our third type are impulsive kids, and they have rapid decision-making and action, as well as poor response inhibition. And our fourth type are sensation seekers, or our thrill seekers, and they have that elevated need for stimulation and risk-taking. So each of these personality profiles has been linked to different patterns of substance use. For example, our negative thinkers, we know that they drink earlier, and when they drink they have heavy consumption of drinking. And we also know that these individuals tend to have to drink to cope with those negative emotions. Our anxiety-sensitive kids, they have a later onset of drinking, but when they do drink, we see that they have increased levels of drinking, and they're more responsive to those anxiety or reducing effects of alcohol. Our impulsive kids, they have early onset of drinking and more problematic drinking. We know that they drink due to poor response inhibition, and we know their drinking is also associated with other high-risk behaviours. And finally, our sensation seekers. We know they drink earlier, they have greater binge drinking, and they experience more harms related to their drinking. And we know the reason they drink is due to the enhancement effects that they get from alcohol. So as well as those links to substance use, these different personality types also link to different psychopathologies. So our negative thinkers are more prone to develop depression and emotional problems. Our anxiety-sensitive kids are more prone to develop panic-related disorders and emotional problems. And our impulsive and sensation-seeking kids are more likely to develop and experience antisocial and risk-taking behaviours. So the Preventure program aims to identify these kids and give these kids interventions to help them cope with these personality types. So the first step in Preventure is to screen students at risk screen the risk of students using the Substance Use Risk Profile Scale. This is a 23-item self-report scale which assesses risk along those 4 personality dimensions of negative thinking, anxiety sensitivity, impulsivity and sensation seeking. What's so interesting about this measure is that it measures personality and not substance use. Therefore, we're able to identify those at-risk adolescents prior to the onset of substance use. The SERPS has been well validated in a number of studies, most recently one in Australia, and it's been shown to be highly reliable and valid in predicting both substance use and emotional problems. So here are the example items in the SERPs. 7 of these relate to negative thinking, and we get participants to indicate the extent to which they agree or disagree with an item on a 4-point scale. So these 7, the ones with the asterisks are reverse coded, but you can see they rate things such as I feel that I'm a failure. These next 5 items relate to anxiety sensitivity, and these are such things such as it's frightening to feel dizzy or faint. When looking at impulsivity, we ask things such as I often don't think things through before I speak. And finally, our sensation-seeking items are things such as I would like to skydive, or I enjoy new and exciting experiences, even if they're out of the ordinary. So once we're able to screen those high-risk kids, which are generally about 40% of a year group, we then invite those high-risk students to participate in the interventions. The interventions are 2 90-minute coping skills workshops, which are focused on these personality types, not substance use. And they're delivered by trained facilitators and co-facilitators in the classroom. The facilitator training includes a 3-day workshop, the first covering the theoretical underpinning of the Preventure, such as the personality, motivation and cognitive behavioural therapy techniques. The second, we look at basic counselling skills. And the third, we review the CBT and MI principles, which are a core component of the program, and we do some role plays. Each therapist or each facilitator is then required to undergo 3 hours of supervision delivering the interventions into schools. So these interventions are based on motivational interviewing, where we get the children to set goals, short and long-term goals, and we talk about pros and cons of behaviour. The cognitive behavioural therapy that they're based on, what we talk about in terms of CBT are understanding links between thoughts, physical sensations and actions, as well as getting students to identify and challenge personality-specific cognitive distortions. And these are things such as our negative thinkers tend to internalise and overgeneralise. Our anxiety-sensitive kids overestimate the probability of something bad happening and often think the worst. Our impulsive kids tend not to think things through and they have an aggressive thinking style. And our sensation seekers tend to think in the extremes and have a need to stand out. So I'm now going to pass over to Erin, who's going to talk about how he adapted this Preventure program for Australian students, and she'll give you some clinical examples as well of each of those personality profiles. Thanks, Erin.
Thanks, Nikki. Okay, so before Preventure was started in the Australian schools, the team spent some time adapting it to make it more appropriate for students in Australia. That involved focus groups with 69 students from 3 different schools, and also a focus group for health professionals and a survey with teachers. Students were first screened with SERPs, and the high-risk students were invited to participate in the focus groups based on their corresponding personality type. So there was 10 focus groups altogether for the students, and they lasted about 90 minutes, and they involved both a questionnaire and also going through the manuals that were specific to their personality type, in which they're encouraged to either discuss their feedback verbally or add their feedback on post-it notes. So the students generally provided suggestions about scenarios as well as the graphics and the vocabulary, and I'll go through the specific examples in a moment. And overall, the teachers gave an indication of the appropriateness of the program in terms of learning, the educational content, student acceptability, and their perceived efficacy of the program. So some examples from the students. One question they were asked was why would they choose to drink alcohol? The main response was peer pressure. For example, they said things like you wouldn't want to be the only one not doing it, or to prove a point, to show that I can do something, to be cool, to be grown up. Also common were things like to party, to socialise, to feel better or forget their worries. For example, they said when you drink alcohol you forget what is happening for a while, and if I was sad or depressed I'd drink to drown my sorrows. They're also asked why wouldn't they drink alcohol. The most common response was short-term health problems. They also listed embarrassment as a problem, or concerns about long-term health, as well as concerns about accidents. They were asked whether they thought their type of personality did have anything to do with the reasons that people would choose to drink, and about 2/3 thought yes, it could possibly have an influence. So they're already something that they're thinking about. They were asked if there was anything that you would change to make the program more meaningful, and most commonly were suggestions about changing the images, the vocabulary, adding more male scenarios, and making it more multicultural. Some examples with the changes to the wording, because it was originally designed in Canada. It mentioned things like get my buzz on for drinking, and they suggested to change it to get hammered. A knapsack was changed to backpack, a lager was changed to beer, and can of soda to a can of Coke. They also suggested some changes to the manual. So you can see on the left there's the old look of the program, and then an illustrator spent work making the covers more up to date, as well as changing the characters and making all the pages more colourful and engaging. If we switch to the teachers' results, overall there was high ratings for the learning content of the program. They thought it was very educational, but slightly lower ratings for how acceptable students would find the program, the language used, and also the length of the program. If I go through some specific comments from teachers and health professionals, in terms of learning, one comment was yes, they would understand the concepts and remember them. Another person said the visuals need updating to support the written material. In terms of educational content, general educational content is appropriate, skilling them for scenarios and appropriate actions and behaviours. And it's not too confrontational, it sits well for the age level. In regards to acceptability, for example, names and pictures need to be changed or updated, some look too old, and perhaps add more scenarios that include technology to make it relevant to adolescents, so the use of iPhones or internet. In terms of language, things like it needs to be more relevant to their age and to Australian adolescents. The language needs to be updated, possibly more acronyms would help. In terms of the length of the program, it was a little inconsistent. So one person, the manuals have a lot of information to cover which could be difficult to get through in an already busy curriculum. The program is possibly not long enough, maybe add a booster session. Someone else said it could be slightly longer, but for the demographics, sometimes the shorter the better. But you could see that the teachers and health professionals thought it probably would be effective for both reducing substance use and increasing their coping skills more generally. So overall, teachers and health professionals felt that Preventure would be effective in reducing substance use and increasing coping skills. All agreed the educational content was appropriate and students would be able to understand and remember the concepts presented. However, they felt that it needed to be updated and made more relevant to the Australian adolescent audience. So in line with the feedback from both students and teachers and health professionals, the manuals were updated. So the appearance has changed, the language, the scenarios, it was made more multicultural, and there was a greater inclusion of the use of technology in the examples. So now I'd like to go through just a few examples from the actual program to give you an idea of the clinical content. So when we had a group based on the negative thinking personality type, we noticed a lot of situations that came up were, or situations that commonly came up were when they got bad marks in an exam, when they lost their phone, when they had a fight with a friend. Someone mentioned their grandfather passing away, not being able to find any of their friends at school, and a common one was actually getting bullied at school. Physical sensations they often mentioned were having no energy, feeling tired, feeling agitated, having a headache, feeling sick, feeling heavy, feeling teary. Example thoughts that came up were things like, I will stuff it up, I can't do this, I'll ruin it for the team, he doesn't like me anymore, I'm not good enough to be around, I'll never make any friends. And actions, one person ripped up their study notes, another often they went to their room to sleep, eating chocolate, talking to others. With anxiety thinking, anxiety sensitivity, situations that were brought up were times when they were preparing for an exam, presenting a speech, or before running a race in athletics. Common physical sensations mentioned were head spins, butterflies, feeling sick in their stomach, having really sweaty palms, feeling shaky and nervous. Common thoughts were, what will happen if I fail? What's wrong with my body? Why do I feel so nervous? And everybody is looking at me. Example actions, stressed too much and stopped studying, stumbled over my words, stayed at home, talked to my friends to get my mind off it. And when we asked for recent times when they felt impulsive, they brought things up like having a disagreement with parents or other family members, the teacher embarrassing them, being angry at their parents, their friends laughing and talking about them. Physical sensations, a rush of adrenaline, feeling frustrated or angry, crying, feeling shaky, feeling tense or flushed. And thoughts, I'm so angry and I don't know what to do with life, leave me alone, you're so wrong, I'm so annoyed, I hate you. And some example actions, storming off, punching siblings, going to the shops and without telling parents, slamming doors, punching walls, walking away. And finally, sensation seeking, when we asked to think of recent times when they felt high sensation seeking, knock and run came up a lot, doing pranks, trying to study on the weekend but really wanting to go to a party, going to a party and not telling parents. Physical sensations that students mentioned were shaking, heart racing, excitement, feeling hyper, sweating, dizzy, feeling happy, feeling energetic or pumped. Thoughts, this is so much fun, I'm worried but more excited, I'm going to burst, how much trouble can I cause without getting caught? And action, ran and knocked on doors and hid, sneaking out, partying with friends, got caught and got suspended. So I'm going to run you through an example that is involved in every manual, and it's called Risky Ways of Coping. So this one I'll do Risky Ways of Coping with Anxiety Sensitivity. So it's run through in the manual that avoidance is a common coping strategy for anxiety sensitivity, and it goes through characters that show examples of them avoiding. It talks about how people with high anxiety sensitivity often rely on others to help them. There's an example of using alcohol and other drugs to cope, and then an example of trying to distract yourself to cope. So then we go through an example, just made one up here called Sally's story. So Sally has been invited to a party. She'd like to go and fit in, but she's really worried about what to wear and who to go with. Yeah, sorry. Her muscles feel tight and her heart is racing. These physical feelings make her even more anxious. She worries she'll end up looking nervous and out of place at the party. She decided not to go to the party. So there's an example of avoidance. So then we did something called decisional balancing with the coping strategy. So put up the problematic coping strategy first and go through this table where it went through short-term and long-term consequences that were both positive and negative. So for example, we would ask the group to come up with what are some positive consequences in the short term. They might have said playing with a phone is a good distraction tool, and that might help her not notice what's going on in the party and feel less anxious in the short term. Then we would ask them, how would playing with your phone at a party help you in the long term? And generally, there weren't many long-term positives, and that's what we were hoping for, to keep that long-term positive box pretty empty. Then we would ask them, what could be some negatives of that in the short term? And they would come up with things like, it could be rude to other people, people might think that they don't like them, they wouldn't really be as much fun as talking to other people at the party. And then long-term negative consequences, we really tried to focus on this box, spend a lot of time getting lots of examples so that this box was nice and full. So they mentioned things like people might stop inviting them to parties because they would think that they don't like it. They have trouble making friends because they're not interacting with others. And, you know, hopefully sometimes we got them coming up with things like, well, if you don't actually talk to others at a party, you're never going to practice getting more comfortable at parties, and you're going to keep being anxious all the time. So we would look at that box and say, oh wow, there seems to be a lot more negatives than positives, particularly in the long term. So what's something that Sally could do instead that would particularly have a lot more positives in the long term? So we would spend some time trying to generate different options and then come up with one that seemed the best. For example, they might say, ask a friend of theirs to come along with them, speak to their friend and ask their friend to help them speak to others at the party. And we'll do the same process, going through the positives and negatives of that, and then see, okay, which coping behaviour was more effective overall. Then I'll run you through some of the examples that we use for challenging your hot thoughts. So basically in the first module we went through the standard ABC model, how important your thoughts are and your actions, and we went through how to identify your thoughts, physical sensations and the influence on their actions. Then in the second module we introduced the idea of hot thoughts, the ones that really lead to your actions. And Nikki went through these briefly, but I'll just go through these in a bit more detail, focusing on impulsivity. So it goes through the 3 common types of hot thoughts for people that are high in impulsivity. The first one is not thinking things through. So the manual goes through things like people with impulsivity are often strong-minded. Their thoughts are action-oriented and they don't think things through before acting. They focus on venting how they feel in the moment. This sometimes causes them to act without thinking. Then there's aggressive thinking. In situations that are frustrating or unclear, we sometimes jump to conclusions that people are purposely treating us unfairly or trying to hurt you. If you think this way, it might cause you to have angry thoughts and actions towards them. And then jumping to faulty conclusions. So in situations that are unclear, we sometimes jump to conclusions which can lead us to misinterpret a situation. If you jump to conclusions rather than gather more information, that might cause you to react impulsively or aggressively. So we go through some characters in the manuals and how they've experienced those kind of hot thoughts and what happens in those situations. And then it goes through how those characters might be able to challenge their particular hot thoughts, and it goes through some examples. So for not thinking things through, when you notice yourself getting excited or tense or a rush of adrenaline, slow down and ask yourself, have I thought this through? Remind yourself of your long-term goal. Will this action get in the way of your goals? So Nikki mentioned at the start of the program, we spend some time getting the students to think about what some long-term goals are, and then we can come back to that in terms of how their particular personality type gets in the way of their goals. So that's something that came through with the thought challenging, was use of motivation, of how we could actually change our thinking to help us achieve our long-term goals. The second one, aggressive thinking. A cue to help you when you're angry is to notice when you feel yourself getting worked up and ready for action. You can step back and look at what you're thinking. Is your way of thinking biased in any way? Think of other ways of interpreting situations that do not assume that people want to hurt you. And finally, jumping to faulty conclusions. Ask yourself, am I considering all the alternatives? You can pay particular attention to alternative ways of thinking. And now I'd like to go back to Nikki, and she will run through the results from the Australian trial.
Okay, thanks Erin. So For us, it's really important that we establish the efficacy of a program before we put it out there into schools. So what we did was we ran a randomised control trial in Australia with 14 schools. Of these 14 schools, there was 1,220 eligible students, and we randomised the school rather than the student to receive either the Preventure interventions over Year 8 or allocated to the control group. All students were then screened for their level of risk using the Substance Use Risk Profile Scale, and approximately 40% of students came up as high risk. Students then allocated to the Preventure condition or Preventure schools were then invited to participate in those Preventure interventions during school hours, and the control schools received their health education as usual, including the mandatory drug and alcohol education over the year. So in total, we had 438 high-risk adolescents from 14 schools complete the baseline assessments. The mean age of these students was 13.5 years. All students, regardless of what group they were in, completed 5 assessments over the 3 years, starting in Year 8 and finishing in Year 11. And all students were measured on their alcohol use, including full serve and binge drinking, as well as alcohol-related harms, symptoms of depression, anxiety, psychological distress, and externalising problems such as conduct disorder and hyperactivity. So what we found is that relative to the high-risk control students, and they're in the red on this graph, the high-risk Preventure students had significantly lower growth in their alcohol use over that 3-year period. So you can see that at the 13 years, the Preventure group started about 10% higher in their drinking, and they ended up about 10% lower than the controls in their drinking. And just to put a bit of perspective on this, we're expecting that students will start to increase use over this adolescent period. So that's why we see an upward trajectory for both groups. So our aim, the aim of all prevention programs is to kind of stem that growth or reduce the strength of that slope. In terms of binge drinking, relative to those high-risk control students, those who received the Preventure interventions also displayed significantly lower growth in their binge drinking over the 3-year period. And in terms of harms related to their alcohol use, relative to the control students, those high-risk Preventure students were significantly less likely to report alcohol-related harms over that 3 years, and they actually substantially decreased the harms they were experiencing as a result of alcohol use. When looking at overall psychological distress, relative to the control group, the high-risk Preventure students also reported significantly less psychological distress over that 3-year period, and you can see with that yellow line they've actually significantly reduced that. And then when looking at internalising symptoms, we found that the kids who received these Preventure programs also had reduced symptoms of anxiety and depression over that 3-year period. And finally, looking at the externalising symptoms, we found that relative to the high-risk controls, again, those students who received the Preventure interventions reported significantly less conduct problems and hyperactivity. And these results were consistent over that 3-year follow-up, which are really fantastic. So as well as knowing if they're effective in reducing their substance use and improving mental health symptoms, we like to know what the students actually think about the sessions. So we asked them, what did you like about the sessions? And here is some of the feedback, including it opens up a part of our personality that we were unaware of, and we got to understand what anxiety is and how to get rid of the feelings. When asked what they didn't like about the sessions, we had comments such as, it can be uncomfortable talking about personal stories, or a very studious female said, it takes up lesson time, perhaps we can do it at lunch instead. So in conclusion, this was the first study in Australia to support the long-term effectiveness of Preventure. It was also the first study in Australia to show that a selective prevention program can be effective. Specifically, we found that receiving Preventure led to lower growth in alcohol use and binge drinking over a 3-year follow-up period, as well as reduced alcohol-related harms and reduced internalizing and externalizing problems experienced by these high-risk students. These results are consistent with the trials that have been done in the UK and Canada. And so now the next step is to focus on translation and trying to make these programs available to schools in Australia. Just before finishing, I'd like to acknowledge the funding for this research, which was the National Health and Medical Research Council, as well as the research team that was involved in running this trial. So thank you.
Fantastic. Thank you so much, Nikki and Erin. That was really, really enjoyable, and I've heard that before and I even still enjoyed it. So that was really great. I really loved all of the really specific clinical examples that you provided, which just made it so clear how you might apply this in the classroom setting. So I'm sure people have questions, so it'd be great if you can stick around for a little while to answer some questions. So if anyone does have questions, please just type them into your panel and we'll get one of the speakers to answer them for you. But just to begin with, I think probably you've shown that this program, which is a 2-session, 90-minute program implemented in schools, can really have fantastic results in terms of reducing substance use, even improving mental health, reducing anxiety, reducing psych distress. So I'm sure a lot of people out there are wondering, how do I implement this myself? Is there a way of getting trained up to be able to implement it myself? So do either of you want to answer that for me?
Yeah, I can do that. So we're actually currently in talks with Patricia Conrod, who is the developer of the program. She is planning to come over here in June or mid-year, and we're then talking about setting up some workshops later in the year, potentially around October, November. But I think we'll be able to send you out a question if you're interested in participating in these workshops with the evaluation of this webinar.
Yes, so if you are interested, when you fill out the feedback form, which will pop up on your screen at the end, there will be a box where you can indicate whether you would potentially be interested in receiving training and what month you'd like to receive that training as well. So that it's a fantastic opportunity for people. And I guess related to that, how do you see Preventure as aligning with the curriculum for teachers out there who might want to apply it?
Sure. We found this in our in the trial as well, that if we gave teachers a clear list of the outcomes that it aligned with, they were much more likely to want to participate in the intervention. And so we have it aligns, I've actually got it here, it aligns to a number of the PDHPE syllabus outcomes relating to self and relationships, as well as individual and community health and lifelong physical activity even. So we can make this available as well, potentially. That might be useful at the end of the webinar.
Yeah, we can do that. So I do have a question that's just come through to say, can we get a copy of the PowerPoint slides? And yes, so at the end of this, you'll get an email which tells you where you can access a sort of shorter version of the slides. But then, Nikki, perhaps we can also add that handout as well for people to access.
Yeah, that's a great idea.
Excellent. And another question that's come through is, what qualifications do people need to be able to be trained as an instructor?
Okay, so there've been a couple of trials. The trial that we ran in Australia, all the facilitators were clinical psychologists, and the co-facilitators had a minimum level of training being a Bachelor of Psychology or a 4-year degree. The trials that have been running the UK, they haven't needed to have the same qualifications, and in fact one of the trials ran it with school teachers who were trained up, so they weren't even the school counsellors. They were, each school was able to give 4 people who were interested in the training. They could be teachers of any subject to deliver the program, and results of that trial found that even with teachers delivering the programs, they were found to be just as effective. But in terms of Australia, we will, depending on the kind of interest we get for these workshops, we'll talk with the developer, Patricia Conrad, about what we can deliver in Australia.
Okay, fantastic. So if there's significant response or enough response, then it's certainly possible to offer that potentially in Australia.
Yeah, I think so, Lexine. Thanks.
Excellent. Okay, so we've got a question here about whether the program can be adapted to older students, do you think, and also delivered in different modules? So for example, do you think it would work to do 3 30-minute modules?
Sure. Erin, do you want to? Yeah, I'll put Erin onto that one.
Yeah, sure. I'll answer the second part first. Definitely, I think if that's what was needed for your school, you could make that work. We had to fit in within the day for the school anyway, so even though ideally it was 90-minute sessions, sometimes we could only do 60 minutes, so we did work out ways how to shorten the program. So you could definitely split it up in a way that sort of worked for you. It probably would be good to get some feedback about, I guess, good spots to stop and things like that, but it could definitely be done. Older adolescents, I might hand back to Nikki for part of this, but I think probably most of the research on Preventure is for this age group, but the research on the actual personality types does also include older adolescents. So in terms of the personality types, I think it would still be effective for older adolescents. This particular program, it was really aimed at preventing substance use before the uptake, and we know that they're coming up to the age of substance use, at least generally drinking around the 13, 14 age, so it's good to get in before, and that's something that Patricia really discussed with us as psychologists running the program. This is a Preventure program, not a treatment, so we're used to seeing people that already have problems with substance use. This was really about trying to prevent those problems from occurring, how to teach people how to cope with their particular personality styles, to make the most of their particular personality and not run into problems. So the older adolescent group could be problematic in terms of not getting in early enough, and potentially the content would be a bit young. It would have to be adapted, but I'm sure you could adapt it in some ways, particularly maybe for illicit substances, but I'm interested to hear what Nikki thinks in terms of that.
I think it could definitely be useful for Year 9 students as well. The concepts would suit both Year 8 and Year 9, and given that we're seeing a bit of a delay in the initiation to drinking age, in Australia at least, I think we could still say it could be effective in preventing before the age of, say, 15. So around Year 9. I don't think you'd want to do it older than that.
Okay, great. Okay, so I guess, yep, so really all of the evidence that we've got so far is really focused on that. So that's the sure bet, this 13, 14-year-old age group.
Yeah.
Okay, great. So we've also got just a few practical questions, if you don't mind, but there's a question about whether you have funding to run this through schools, and I guess related to that, whether the instructors tend to be paid to run the program. I don't know if that's something that you can answer, Nikki, but just to give some, I guess, guidance around possible models around implementation.
Yeah, so this is something we're exploring at the moment, and I'd be happy to email this person or talk to this person more about it. The model that Patricia uses in the UK and in Canada is that she gets the individual teacher or school counsellor to pay for that workshop. That then goes to pay the trainers and pays for the manuals and for the development. Ideally, it would be great to get funding from the Department of Health or Education to roll this out, but we're not at that stage yet. But if anyone knows anyone, feel free to get in touch.
Okay, fantastic. Feel free to campaign for that.
That's it, for Preventure.
Okay, now some more really interesting questions coming through. So one is whether you intend to follow up the students from the trial, so longer term, I guess.
Yep, so we've been very lucky actually to have just received funding from the National Health and Medical Research Council to follow these kids up for an additional 3 years. So right now they are first year out of high school, and in a few months we're going to be going and trying to find those kids. I'm not sure how easy it's going to be, but we're going to do our best to follow them up for this year as well as the next 2 years as they transition into adulthood.
Fascinating, and that's going to be so exciting to see. So as they're age 19, 20, whether the benefits of a program administered in year 8 can sustain all that time. It would be fantastic if they did.
Yes, cross fingers.
Yeah. And another question then is whether there's any research on suitability of this program for Indigenous students.
We don't know that answer. There's no evidence in our trials because we didn't actually ask that question, so we're not able to break it down by Indigenous groups. We are currently starting a new Positive Choices program looking at Indigenous youth, so we will explore that option of potentially adapting this as well as other evidence-based programs for Indigenous youth.
And I might be wrong on this, but is it possible, was there a trial with Indigenous young people in Canada? Yes, I believe there was.
I think you're right, Lexine. Yes, we can dig up that paper as well, and can we distribute that to the listeners?
Yeah, certainly. So perhaps the best is if you are interested in hearing about that paper, to email Nikki, whose email address is up there right now, and we can send you that paper. Yeah, so very interesting paper trialling it in Indigenous Canadian youth. Okay, so yeah, so this has been really fantastic. I think that's all of the questions that we've got coming through, unless someone wants to shoot through a last one. Nope, that's it. So thank you so much. You're off the off the hot seat now, Nikki and Erin. Thank you very much for sharing your afternoon and your time with us and answering all these questions. And thank you to all the participants for your very interesting questions. It's been a really great session. And we do hope that you will join us again for a future session. So as I said at the beginning, we have coming up at the 25th of May, we've got our next webinar, and that will be on the topic of what parents can do to act as advocates and prevent substance use. So do register for that session and join us, or you can also go to positivechoices.org.au /webinars and access all of our previous webinars. The video is now available on demand. Okay, well thanks Erin and Nikki, and hope to see everyone again soon.
Thank you.
Thanks, Lexine.